Patient Lookup is the default view. Exam Lookup allows for more specific search criteria. You can search by a session number, date range, and other choices. You can right-click on a column to add more columns. Notice there are many more columns available than there are in Patient Lookup. When you search an exam lookup, it's important to note the icon columns. You can add or remove icons by right-clicking. It's generally best practice to add them all. The icons show that an exam is stat, locked, linked to other exams for easy image view, read by a radiologist, or that a diagnostic report is tied to the study. The yellow box indicates that notes are associated with the study. For example, if I create a quick note by double-clicking the study and clicking the View Clinical Information button, I can create a note. The note can be marked critical. If I close the exam, you notice that now you see a yellow rectangle icon denoting that there's a note on the exam. The exclamation point denotes that the note is critical. You can also right-click a patient's name to quickly view a report. This is also available in Patient Lookup. And the final icon shows that images are associated with the study. You don't have to memorize what all of these icons mean. If you right-click on an icon, the icon labels are listed in order at the top of the drop-down menu. Some exams display the Report Available icon. To view a diagnostic report, simply open the exam by double-clicking. This is the View Clinical Information button. Click it to open up the diagnostic reports. Reports can be printed by clicking the Print button, or closed. After viewing an exam, you can close the exam by clicking the tab. You may also look up another patient without closing the first. To do this, open one exam and click Exam Lookup. Open your second exam. When you close your second exam, you'll be presented with your first. Remember that Exam Lookup is generally used to find exams and allows for more specific search criteria than Patient Lookup does. Let's look at how to view images. After you find the exam that you're looking for, double-click on the exam to open it. Patient information is on the top in the Patient Information area. This area is the patient history timeline. The most recent study is on the left, and year markers allow for easy study pinpointing. Click a study in the timeline to view. Notice that previously viewed studies stay open. You can scroll through all of the studies you currently have open. If a study shows as blue in the patient history timeline, that means there's a report available for that study. If green, no report is available. An X on the timeline means there are no images associated with that exam. The lack of an X or a bar means that there are images associated with that exam. This area is the exam rack. The clipboard icon will display clinical information associated with that exam. Click to view. Clinical information includes diagnostic reports, exam notes, clinical info, related exams, all exams, and current providers. If the clipboard icon is blank, there is no report associated. The appearance of red lines on the clipboard icon show that a diagnostic report is available. If a note is available on an exam, the clipboard will show a little yellow note. The note will have a red exclamation point on it if the note is critical. All clinical information can be printed if desired. To view an image, simply double-click it. While viewing an image, you can right-click the image for options. For example, window width and level. You can add text annotations. Right-clicking an image in the rack provides more options. For example, the options to delete an image or to assign a new unique study UID. Special administration permissions are required for this. You can also export via DICOM. You can also use the exam margin to export via DICOM, to add an exam to a folder, or to recover images that you may have deleted. To close an exam, simply click on the tab.